Can dementia be prevented? There's good evidence that a healthy lifestyle can help reduce your risk of developing dementia when you're older. A healthy lifestyle can also help prevent cardiovascular diseases, such as stroke and heart attacks, which are themselves risk factors for Alzheimer's disease and vascular dementia, the two most common types of dementia. Risk factors for dementia. Some dementia risk factors are difficult or impossible to change. Age: the older you are, the more likely you are to develop dementia. However, dementia is not a natural part of aging. Genes: in general, genes alone are not thought to cause dementia. However, certain genetic factors are involved with some of the less common types. Dementia usually develops because of a combination of genetic and environmental factors, such as smoking and a lack of regular exercise. Lower levels of education. Research suggests other risk factors may also be important. Hearing loss. Untreated depression. Loneliness or social isolation. Sitting for most of the day. The research concluded that by modifying the risk factors we are able to change, our risk of dementia could be reduced by around a third. Experts agree that what's good for your heart is also good for your brain. This means you can help reduce your risk of dementia by eating a healthy, balanced diet, maintaining a healthy weight, exercising regularly, keeping alcohol within recommended limits, stopping smoking, keeping your blood pressure at a healthy level. Diet and dementia. A diet that's high in saturated fat, salt and sugar, and low in fiber, can increase your risk of high blood pressure, high cholesterol, becoming overweight or obese, and type 2 diabetes. Exercise and dementia. Lack of regular physical activity can increase your risk of heart disease, becoming overweight or obese, and type 2 diabetes, which are all linked to a higher risk of dementia. Older adults who do not exercise are also more likely to have problems with memory or thinking, known as cognitive ability. What you can do: follow the recommended guidelines of doing at least 150 minutes of moderate intensity aerobic activity each week, such as brisk walking, cycling or dancing. You should also do strengthening exercises at least twice a week, such as gardening or yoga. It's also important to sit less, so try to get up and move around regularly. For example, take the stairs, walk up escalators, and make phone calls while standing up. Alcohol and dementia. Drinking excessive amounts of alcohol increases your risk of stroke, heart disease and some cancers, as well as damaging your nervous system, including your brain. Stick to the recommended limit of drinking no more than 14 units of alcohol a week for both men and women. If you regularly drink as much as 14 units in a week, you should spread your drinking over 3 or more days and have several alcohol-free days each week. Smoking and dementia. Smoking causes your arteries to become narrower, which can raise your blood pressure. It also increases your risk of cardiovascular disease, as well as several types of cancer. Depression and dementia. The relationship between dementia and depression is complex. It appears that having untreated depression increases your risk of developing dementia. However, depression can happen as part of the overall symptoms of dementia itself. Regardless, low mood, anxiety or depression can all affect your ability to be socially active and engage in mentally stimulating activities. For more detailed information, please check the description below. If you enjoy it, please subscribe and share with your friends to help me create more content.